بسم الله الرحمن الرحيم. أرحب بكم في الكورس الصيفي Community Medicine، وأتمنى لكم التوفيق والنجاح، وإن شاء الله بكون الأمور سهلة عليكم ومبسطة. Welcome to this summer course. Let's begin with definitions. We'll begin with definition of public health. Public health includes three components: the mission, the substance, and the organizational framework. Mission is fulfillment of society's interests in assuring the conditions in which people can be healthy, while substance is an organized community effort aimed at prevention of disease, promotion of health. Just keep focus on these two words: prevention of disease, promotion of health. This is really a big issue as a substance, big understanding of what public health is about. It is about prevention of disease and promotion of health. How can we achieve that? With an organizational framework, with the involvement of the government. So it's a joint activities of mission and substance. Who will do it? The governmental agencies, associated efforts of private, voluntary organizations, and individuals. What are the new challenges in public health? Public health, as we said, it is about prevention of disease and promotion of health. So when we are talking about all issues related to individual people's health, it's related or involved or included in public health. So the burden of disease, how much the disease represents a burden, and the health systems and health disparities. Public health really is interested in having no disparities in health issues and health system to be fair, health systems to tackle all issues and be able to cover all health issues for population. Nutrition and malnutrition, maternal and child health, adolescent health, non-communicable diseases, the chronic disease, and communicable disease also, which recently we saw the new emerging epidemics and pandemics like corona. Mental health and addiction to smoking, which is a very, very big problem worldwide, and illicit drugs. Primary health care is a method or approach that will help very much in preventing of disease and promotion of health. Why we go for primary health care? It is the simplest approach and simplest and the easiest accessible approach of health care that can be used to cover all health issues. When we look at the literacy, education, the income, the socioeconomic status, and many other variables, they are related to primary health care, and health care itself is related and change due to these variables. So we look at literacy, education, they are low. Look at the infrastructure, roads, public transport, water, electricity, supply, all are underdeveloped. Health facilities also and personnel are concentrated in one or two cities rather than in the rural areas. Rural areas, mostly they are deprived of a good hospitals or big centers. Cities are growing, but with poor immigrants from the rural areas or poverty, pockets in these cities, big cities, with poverty, poor housing, sanitation, and so on. Population is growing fast, whereas the gross national product is static or going down per head per capita of population. And also the women carry a considerable burden as bearers of children and carers of families, while suffering from poorer schooling and low status. So the definition of primary health care: it is a practical approach to making essential health care universally accessible to individuals and families in the community in an acceptable and affordable way and with full participation. What are the core activities of primary health care according to the Alma-Ata Declaration? Education concerning prevailing health problems, promoting food supply, adequate supply of safe water, maternal and child health care, family planning, immunization, prevention, control of locally endemic and pandemic diseases, appropriate treatment, provision of essential drugs. So why also we still talking about primary health care? A lot of needs, health problems related or rooted in the socioeconomic problems. Conditions presenting at the first level of health service tend to be the same. Diarrhea, for example, respiratory, non-communicable diseases, communicable infectious diseases of childhood, such as measles, polio, and others, malnutrition, pregnancy and childbirth and complications. All these are prevented with proper primary health care involvement. Another approach which is really also important is the global health. Is thinking beyond the boundaries of national boundaries, international. When health problems takes problems cross national boundaries. Traditionally, the focus has been on those health issues that impose the greatest burden. This has shifted to address the challenges and encompasses a broad range of disciplines. Global. As an example of involvement of international societies and health agencies, the United Nations Millennium Development Goals Declaration, it's about achieving these goals by the year 2015. It passed, so now they propose the sustainable goals. After achieving these goals, it should be achieved. So we worked on achieving these goals even in Jordan. Eradicate extreme hunger, poverty, achieve universal primary education, promote gender equality and empower women, reduce child mortality, improve maternal health, combat HIV/AIDS, malaria, other diseases, ensure environmental sustainability, develop a global partnership for development. So now we'll be talking about maternal and child. If we look at the population pyramid, اللي هو الهرم السكاني, it's affected by the fertility rates in countries. In developing countries, fertility rate is high, very much higher. Male, female is the same, and younger population, including children, are the majority. While in developed countries, the majority, there is no majority. We might look at it between the 35 and 54. These are the majority ages. And the basis, قاعدة الهرم, as we see, it's minimum with 0 to 4, 5 to 9 years, while in the developing countries, mostly the majority is 0 to 4, 5 to 9, and so on, because of high fertility. So if we look at this also graph, it's very important and it will give us a lot of information. Just focus on these underlying conditions. They will cause intermediate outcomes and symptomatic issues and will lead to desired outcomes. If we look at the underlying conditions, education, family income, related to family planning, related to national income, gross national product, access to primary health care, prenatal, and so on. So let's begin with education. With education, we can achieve everything, good education. With good education, the big arrow will go to poverty reduction. Smaller, reducing or reduce maternal mortality. Also, smaller family size. Also, reduce perinatal child mortality. reducing disease, proper family nutrition, proper water, sanitation, hygiene, with proper education, proper family income, proper family planning. So when we have proper family planning, lower population density, and we will reduce teenage pregnancy, and of course we will reduce maternal mortality. We will increase birth spacing, which also will lead to reduced maternal mortality. With proper family income, poverty reduction. With proper family income, proper family nutrition, water, sanitation, and so on. So all these are interrelated, and these are the desired outcomes. Maternal and child health practice field concerns are these. I will leave them to you to read them. They are simple, and you should just know about them. Also, monitoring, designing, implementation, progress, appropriate health programs, and so on. Regarding the surveillance, it's very important. It means that we have to know about the situation where we live, or for our country, or internationally, globally. It's an ongoing systematic collection. It means that it's not just when I want to send or collect data, I will do it. If I don't want, I will not do it. It is a systematic. It's by law. You have to report. You have to always make assessment of health status, of pregnancy complications, pregnancy care, delivery, perinatal mortality, neonatal status, neonatal mortality, and so on. These are data that has to be collected regularly, systematically, analyzed, interpreted, and essentially they will help in planning, implementation, evaluation of maternal child health practice, integrated with timely dissemination. I don't want to know about 2010. I want to know about 2020, if possible, or 2019, 2018. So it's a timely dissemination of data, so I can build my planning, implement my evaluation, and so on. Why it's important? The maternal child health, maternal and children, mothers and children are vulnerable, and they would represent some 60% or maybe more of community, reproductive age. And also they are influenced by surrounding factors, socioeconomic, environmental, and pregnancy itself, it's a potential risk. Psychological and physiological factors involved. Pregnancy also is a bi-beneficial procedure. For the mother and the baby, we can intervene with good intervention called prenatal care. Prenatal care is as an essential and golden opportunity to offer help and care for mothers. Those who don't have prenatal care, they suffer from a lot of hospitalization. Maybe the infant, they will suffer also. Internationally, globally, prenatal care is related to lowering, adequate prenatal care related to lowering infant mortality. Also, the most extreme negative outcome, which is death, both mothers and babies, is highly concentrated around the time of delivery, 48 hours postpartum or post-abortion. That about 2/3 of maternal deaths occur within this time window, so it is important to give extra credit or importance for this care, quality assurance, and effectiveness. Let's talk about reducing child mortality and improving maternal health, which is goals 4 and 5 from the MDGs, Millennium Development Goals. As I said, they ended by 2015, and we worked with we worked with them. We assist the achievement in maternal mortality, infant mortality, neonatal mortality within the last 10 years. So the present status of maternal child health in general are evaluated by maternal mortality and infant mortality. Both have decreased significantly since the 1960s. Now maternal mortality is around 28 or 29 per 100,000 live birth. Infant mortality is around 14 per 1,000 live birth. Good achievement, but we still need to reduce these indicators for better health status. Specific objectives of maternal and child health services and discipline. These are: increase equitable, accessible reproductive health, strengthening reproductive health service capacity, increase awareness, reduce adolescent pregnancy, identify risk factors for maternal morbidity, complications, protect maternal health status, prevent complications before, during, and after. Also increasing coverage of prenatal care, reduce unplanned, unwanted pregnancy, which is a big issue because a lot of these pregnancies are unplanned, unwanted. So we need to do better in family planning. Protect children against infectious, chronic, other diseases, early detection and screening of chronic and cancers. The overall efforts of maternal and child health professionals involve practicing MCH to provide healthcare service based on most recent scientific research evidence in priority topics specific for each country or community. So services, it should always meet the needs, because there should be needs or evaluation of the health status, and according to such evaluation you will propose and implement these healthcare practices or services. If we look at maternity care, it includes preconception care before getting pregnant. We make evaluation, assessment, and health education. It means risk assessment, health education. When they get pregnant, prenatal, antenatal care, risk assessment, continuous care through delivery, postnatal care also after delivery, family planning, counseling, providing contraception, health education, also child health care, immunization, monitoring, growth and development, and also the Well Women Clinic, which is about routine check, physical examination. Thank you.